Welcome to another episode of Ask a Psychologist with Ms. Hana Haniffa. Today, we are here to talk about depression in children. Depression is a common mood disorder that many people around the world experience. According to WHO, an estimated 280 million people in the world have depression. So, let's learn how one could deal and cope with depression. Hi, Ms. Hannah. Can you please introduce yourself?
Hi, I'm a lecturer in psychology with a master's degree in psychotherapy and counseling and a bachelor's degree in psychology. I've been teaching psychology at various institutions around Sri Lanka for the past 13 years, and I've been working with various programs ranging from diplomas to even master's degrees in psychology, education, counseling, early childhood, and a few others. I'm also the founder of Easy Education, where we offer customized workshops and training programs for schools, colleges, and universities, and the corporate sector as well.
What is depression?
Yeah, so depression is a mood disorder that causes a lot of feelings of sadness and or a loss of interest in the activities that you once enjoyed. It can lead to a variety of emotional and physical problems and can decrease your ability to function at work and at home. It is a serious illness, but it is also a treatable one. So if you experience depression or symptoms of depression, it is very important to seek medical help or psychological help at your earliest, as it is a treatable condition.
Can children have depression?
Yes, children can experience symptoms of depression and they can also be diagnosed with depression. Childhood depression, however, is different from the normal everyday emotions that children go through as they develop. Just because a child is sad doesn't necessarily mean that they have depression. But if the sadness becomes more persistent or interferes with the normal social activities, interests, schoolwork, or family life, it may mean they have depressive illness or they might have to be assessed by a qualified psychologist or a psychiatrist to further investigate their symptoms and give them a proper diagnosis.
What is depression in children like? How can a parent recognize
it? Children can experience a variety of symptoms. It may actually vary from child to child, but typically most children experience some of the following symptoms that we will be looking at today. Crankiness or anger is very common in a lot of children. Continuous feelings of sadness or hopelessness. Social withdrawal, where they refuse to go out and play with their friends, or they would refuse to or not be interested in making new friends. So even if they're in a crowded place, they may not really be interested in socializing much. They'll start being more sensitive to rejection. So even the slightest thing that someone would say to maybe tell them to join in later or take part in an activity later, even the slightest rejection will start becoming more painful to be accepted or to be dealing with. Some children may experience changes in their sleep where they either sleep more or they might sleep less. They might also see changes in their appetite, where again, it's either a high level of like hunger, so where they eat a lot, or they may start eating very little. They could have vocal outbursts or start crying very often. They'll have a lot of trouble concentrating in class or concentrating in any activities that they might be engaging in. Some may experience fatigue or low energy, while others might have physical complaints like stomach aches or headaches. And these are not just the regular complaints that children make just to make excuse for not going to school that day, but these are stomach aches and headaches that they might experience very often. And parents will start being able to distinguish between, a serious condition where the child is actually experiencing something and complaining about something, and where the child is just faking it, to get away from school. So these are physical complaints that may not actually respond to the typical treatment options that the parent might use, or that they might even offer at the hospitals. So the child will have, these as a persistent complaint over a long period of time. They will also have trouble during events and activities at home or with friends, sometimes in school or during extracurricular activities, or even engaging in hobbies or interests. Feelings of worthlessness or guilt may also be present. So children might find it difficult to feel, appreciated or feel happy about what they're doing, and they will not be able to really appreciate their own efforts. And even if others do accept them and do see the worth in them, the child internally feels very worthless, or might even feel guilty for anything that might happen around. So, for example, even if they have, homework due and they couldn't finish it on time because they had a headache, they'll feel guilty and say, I'm not capable of doing it. I'm not good at it. I'm not really able to complete anything. This is all my fault. Let's say, for example, the mother ends up, having something that is happening, in the kitchen, and she drops a plate. Even for that, the child might blame his or herself about it, right? They'll start complaining and feel bad about what happened, and might really think that they were the cause of it. So there's a lot of guilt that falls in between these factors as well. There could be impaired thinking or concentration as well.
So are these symptoms present in all kids with depression?
No. Not all the children have all these symptoms of childhood depression. Sometimes some children will experience some of these symptoms, while other children would experience a different set of symptoms. And, might not include all these items on the list that we just looked at. However, what might happen is it may vary from child to child, depending on their experiences, depending on their causes. So it will all vary depending on what they're really going through. So in fact, the kids have different symptoms of childhood depression at times that may vary, and even in different settings or different setups. So some children might contribute, so some children may continue to function reasonably well in a structured environment, but most children with childhood depression will suffer a very noticeable change in social activities, or have loss of interest in school, have poor academic performances, or even a change in appearance. And children may also begin to kind of, go towards the use of alternatives to make them feel happy, to make themselves kind of feel more appreciated, or to kind of blend in with the cliques and things like that. So they might start trying out alcohol or trying out smoking and other things, which might make them feel like it would be a way out of feeling sad and feeling excessively low in what they are experiencing at that point.
What could be the causes of depression in children?
Due to family difficulties, such as parents separating, bereavement, or problems with school, or other children in particular, like bullying, physical abuse, emotional abuse, sexual abuse, all these factors could fall as a reason behind the causes of depression. So basically, children who experience trauma, children who experience difficult situations that may be particularly unsafe or unhealthy for a child to grow up in, either at home or in school, where their overall well-being is affected, could also fall as a cause for depression. So primarily their physical health, the life events, family history, environment, even genetic vulnerability, and the biochemical disturbances could fall as a factor. So if one parent or both have a genetic component of depression where they are already experiencing depression or they have had depression before, that could be a reason or a cause as well. So genetically, they could be prone or more vulnerable to experiencing depression as their child. Their environment, the life circumstances, the family history, like what the family has been going through and how they have progressed in life. All these factors could also fall as a cause. The child's physical health. Let's say the child becomes diagnosed with a chronic condition or some level of a disease or a disorder that might be apart from their mental health, could also be a reason for why this child starts to experience these symptoms of depression, which could actually make them feel bad about themselves, feel hopeless, feel worthless, and feel guilty that they might have done something wrong to have been diagnosed with it, or they might have been the reason for why they became sick. So all these feelings, all these emotions bring in this environment where they're not really told that it is not their fault. They're not really explained that it was nothing in their control, that they could have changed anything. But something happens. So when the child isn't given the necessary support to overcome these emotional issues, because they experience other events in life, could also lead to depression. So it's very important to provide a child with a very healthy, loving, and caring environment where they could grow up, where these types of issues, such as especially issues related to bullying or physical, emotional, abuses at home by the parents or siblings or others, similar issues within the school should all be prevented as much as possible or avoided as much as possible. But if the child does get exposed to one of these issues, they should immediately be given help provided with mental care help so that these symptoms don't start and that they don't really get into the realm of experiencing depression as a result of these incidents. So immediate first aid care for people who experience such unfortunate events is also a very important thing to keep in mind.
What should a parent do if they feel that their child is experiencing depression?
If you think your child is depressed or is experiencing depression, there are a few things that as parents, you will have to do. First of all, you should make time to talk with your child about sadness and depression. Kids are not aware of why they are sad and the reason for the things that happen around them. So listening to them, comforting them, offering support, and showing them unconditional love is one of the best ways to help the child overcome the event that might have happened, the incident that might have happened. Ensuring them that you are there for them and that you will be there behind them to take care of them and you will always have their back. That assurance itself is another way to support a child that might be experiencing symptoms of depression or that might be diagnosed with depression. So one of the biggest pillars or the strengths of providing for a child with depression would be to be there unconditionally. Right? Be available to listen, be available to comfort them in the times that they feel the worst, in the times that they feel the lowest. So providing that support and being there as their support network can be the biggest remedy that you would provide for a child. Secondly, being patient and kind. When your child acts moody or aggressive or tries to kind of give you trouble, it's important to stay patient. Find the best way to respond and connect to them in a calm manner and kind of find a way that you could provide them with support, that you could provide them with some level of comfort. So even if the child is acting in the most aggressive manner or acting in the most unacceptable manner. As a parent, it's important for you to stay calm and for you to stay put and be the best of your behavior and provide them with the comfort that they need. Understand that they are not doing this because they're a bad child, but because of what they're experiencing. So it's uncontrollable at that point for them. But the moment you start providing the kindness, the support, and the love that you have to, the child will also automatically start calming down, and they will start understanding that their behavior was wrong and that they should kind of control their emotions as well. So kind of try to find ways to make them feel better, make them rest, and make them kind of relax. So as a result, they will also kind of start changing. And the next thing you could do is spend time with children by doing things together. So you could especially, do things that both of you enjoy, like going for a walk or playing a game, cooking together, reading books, or making some sort of a craft, watching a movie, or even just spending time outdoors, just relaxing under a tree, reading a book. All these things can help encourage positive moods in a child and can keep them engaged as well. So that way they're not disturbed by the negative thoughts, by the thoughts that are really bothering them, that is taking them into that component of feeling sad or feeling low. So it kind of helps them boost their mood and boost their energy and also keeps them distracted. So that way they are in a better mood throughout, and these activities and engagements and you being there with them as a parent will also support them and make them feel better at the end of the day.
Subscribe to our channel and watch more of our Ask a Psychologist interview sessions. You can also drop your questions in the comments and we will answer them in our next video.